I've always been interested in transplant and vascular surgery. The patients are very complex. They have a lifelong disease process. It's very interesting to take care of them, and it's a real opportunity to help renew their health. Well, the biggest issue in transplant is the lack of availability of organs. So we have patients waiting on a list for organs, and they commonly wait 4 to 5 years. Then they get a phone call, surprise them in the middle of the day or the middle of the night that there's an organ available, and have the opportunity to bring them to the hospital and transplant it. And it's usually a joyous occasion to liberate these people from dialysis and be able to do a surgery that's going to really impact and improve somebody's life. The results are very good for kidney transplantation, so about 95% of people have a functioning kidney a year after the surgery and are doing great off dialysis and living life independently. So the expectation for everybody coming into the surgery is that they're going to be off dialysis and have a big improvement in their quality of life. It's actually one of the things that drew me to transplant surgery is that it's a lifelong endeavor taking care of these patients. They have diabetes and hypertension, a lot of medical issues that impact on their future care. So we meet the patients early, we follow them pre-transplant while they're on dialysis and waiting for a kidney. We obviously take care of them during the kidney transplant episode, and then we follow the patients for years and usually a lifetime afterwards to manage their immune suppressive drugs and help with their other medical issues. When somebody passes away in such a manner that they could be an organ donor, obviously it's a very difficult and trying time for the family. And if patients have spoken about organ donation before they die, so when they're healthy and sitting around the dinner table or whatever setting with their family, it makes it so much easier for the family to consent to organ donation, knowing that the person would have wanted that should they pass away. So another way to do that is through the organ donor registries, which you can do through the Department of Motor Vehicles, or you can do online nowadays through the New England Organ Bank. And if you make it known at that time that you would like to be an organ donor, if you're in such a predicament where you have passed away but have usable organs for transplantation, it makes it so much easier for the family to know your wishes, be able to donate the organs, and then impact on so many lives through transplantation. I think the best part is seeing somebody on their first or second return to the clinic after a successful kidney transplant, and just seeing them rejuvenated and off dialysis, and so grateful not only to the surgeon but to the medical staff that help take care of the patient, and also to the always to the donor family.